Thank you, Megan, Dr. Jerome Williams, and Jillian. Ready to take your phone calls today.
Good morning.
Good morning. Jillian is at attention and ready to talk.
She's ready.
So if you have a question, 741-9272 is the number to call. All right, we have callers on the line already, Dr. Williams, so let's go ahead and get to those. And Suzanne, I know you told me who the first caller was, and I can't remember. Hi, Cindy. How are you?
Oh, I'm fine. How are y'all?
Good.
Hello,
What's
Cindy.
your question?
Yes, I have a Yorkie. He's probably, 7 years old. But I think when I bought him, I think the people sold him to me. They even opened his eyes, I think. He wasn't even 6 weeks old. So he's had a little hard time through his life being sick. But he has this hacking cough. I take him to the vet, and sometimes he throws up a white-looking stuff.
Oh, baby.
And the vet thought that he has bronchitis. But this has been going on a couple of years. He'll get rid of it, give him a shot, medicine. He comes home, and then maybe 8 months later, it comes right back.
Sounds like they're not getting to the bottom of it. I'm not sure what it may be. Could be something like a collapsed trachea, where the windpipe is collapsed.
So why would it improve, though, or not show signs of it?
The medication they're using may be an anti-inflammatory.
Just works for a while?
Bronchodilator, yes. But it seems like they're not getting to the bottom of it. You know, your veterinarian have to look a little harder, a little deeper. But I'm certain they can get to the bottom of it. Once a diagnosis is made, then a treatment plan can be implemented.
But this has been going on for over 2 years. And I was wondering, do you have a veterinarian office? Because I watch you on TV, and I really like their information.
Well, he does have an office. It's on Green Springs Highway here in the Birmingham area. So it's called Red Mountain Animal Clinic.
Red Mountain Animal Clinic.
That's right. He is not here just to advertise his place. He is here just to answer phone calls, but we don't mind letting you know where he is.
Great. Red Mountain Animal Clinic. And what was the veterinarian's name?
It's Dr. Jerome Williams.
Great. So that's what I need to do to get to the, because I'm not getting to the root of the problem.
Well, you let Dr. Williams check it out and see what happens, okay?
Okay. And it could be his trachea trying to close up on him.
If we can't get to the bottom of it, we'll refer you to somebody that will.
Okay.
All right. Thank you,
but
dear.
Is that what you thought? Maybe his trachea?
Well, I hate to try to diaggnose
Right.
on TV, so let's leave it at that, please.
Okay.
Okay.
I
Thank you,
look
dear.
forward to meeting you.
Okay.
Thanks.
All right, that's cute. All right, let's, is it Anya is in Homewood. Hey, Anya, how are you?
Good. How are you?
Good. What's your question?
We have a little Shar-Pei rescue, and when we got her, her eyelashes were turned in, so she had ulcers on both eyes, which we had fixed. But now in the last day, she looks like she's developing cherry eye, and we're wondering if there's something we can do before it gets too bad.
Okay, I'm going to ask, what is cherry eye?
Cherry eye is a gland called the Hadarian gland. It's underneath the third eyelid, and you see dogs with something right in the medial part of the eye, right in the corner, and it sort of bulges and is red usually.
Oh, okay.
You see it most often in Cocker Spaniels. It's an infection of that gland, and surgery is required to actually tuck that gland back in. Antibiotics will help it for a while. It may go away for a little bit, but it almost always comes back.
So what should she do?
Surgery will be required eventually. Your regular veterinarian may be able to do it. If not, then he'll refer her to one of the 3 ophthalmologists that we have in town.
Okay. Well, thank you so much.
Okay.
Thanks, honey. All right, let's go to Terry. Terry's in Birmingham. Hey, Terry, how are you?
Fine, and you?
Good. What's your question?
I have a little Shih Tzu, and he has a terrible habit of wanting to nibble on your hand, or he's biting on your hand at all times. And I was wondering what caused that, and what can I do about it?
It's a behavior thing that. How old is he now?
He's about 1.5 years.
Yeah, it's something you're gonna need to get corrected.
This becomes a part of his habit in his life, yeah.
Right. You're gonna need to do some behavior modification things, and Dr. Larry Myers, a behaviorist here in Birmingham, could be very helpful in giving you some techniques that can correct that. But it's something, when you got a young dog, start out early in correcting those bad habits so they won't have them the rest of their life.
So if you need to contact, you can contact their office and they can recommend a behavioralist Or, I mean, you could even go as far, I guess, to Google some information and see,
Right.
you know, if there's something that you could do at home before you did that, if you didn't want to spend the money.
Yeah, there's some things that you can go on the internet and
Yeah.
find, some procedures you can
Okay.
use. And some of them will seem a little harsh when you read about them, but they're
can do it.
required to break the habit.
All right, well, that's all the time we have today. Dr. Jerome Williams, thank you, sir.
Oh, it's good to be here.
Red Mountain Animal Clinic. All right, now here's Jay.